Disease is something we have all experienced. But what is it? It's intuitive to know when we are ill. But what is disease? How is it defined? This video lecture will attempt to give you some answers to this question. Articulating a precise definition of disease has proven to be very difficult in the medical community. As we can see in this slide, human diseases only exist in relationship to people and where they live in various cultural contexts. We refer to illness as something that people experience, like the flu, like a cold, whereas physicians treat the disease in the human being and vets in the animals. So if you go to the doctor because you're complaining of flu symptoms, they're going to give you medicines to treat the symptoms. Or if you have a bacterial infection, they will give you antibiotics to treat that particular infection. So for definitions, we have many. These are just a few. It's a condition of the living animal or plant body or of one of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. Sickness, malady, infectious diseases, a rare genetic disease, heart disease. And that's from the Merriam-Webster dictionary. The Britannica defines it as any harmful deviation from the normal structural or functional state of an organism, generally associated with certain signs and symptoms and differing in nature from physical injury. A diseased organism commonly exhibits signs or symptoms indicative of its abnormal state. A .com, the conversation.com, what exactly is a disease, is an abnormal condition affecting a living organism. It's a little bit more generic. In your ebook, Professor Shaw has found a definition. It's a disease is any condition in which the normal structure or functions of the body are damaged or impaired. Physical injuries or disabilities are not classified as a disease, but there can be several causes for disease, including infection by a pathogen such as a virus or a bacteria, genetics that are non-inheritable such as cancer, genetics that are inheritable such as sickle cell anemia, non-infectious environmental causes such as lead exposure, or inappropriate immune responses when one is immunocompromised. Signs, what are signs and symptoms? We use these words often interchangeably, but there are specific differences between them. Signs are directly observable. Nursing students and exercise science students probably know this already. So these are measurable. When you go to the doctor, they do a blood test. They look for your red blood cell count, your white blood cell count, the number of specific white blood cells in the blood. They look at ions like chloride, potassium, sodium in your blood plasma. They will measure your vital signs such as blood pressure, your pulse, your oxygen levels, your respiratory rate, and anything that deviates from normal parameters may be indicative of a disease. Whereas symptoms are voiced by the patient describing the illness. These are subjective. They're not easily measured objectively. For example, the patient says, doctor asks, what are your symptoms? The patient says, well, I feel tired. I don't have much of an appetite. I'm in pain, but sometimes it's stronger than others. I have nausea. These cannot be confirmed or measured clinically. Doctors do have a somewhat objective measure of pain strength on a scale of 1 to 10, but that's still subject to the patient's own interpretation of what they're feeling. Clinicians will measure specific things, like I said, CBCs, complete blood count, enzymes, to see if there's anything wrong with, say, your kidneys or your liver function. They'll look at your blood electrolytes, a lipid panel to see what your cholesterol is and specify high-density lipoproteins or low-density lipoproteins. They'll look for the presence or absence of antibodies if the signs specific, if the patient's symptoms suggest they may have been exposed to a virus. They'll look at your skin, and they'll, kind of look for any abnormalities. They rely on questions to the patient. They rely on their visual observations. They rely on your medical history, your recent activities. Almost every time you go to a doctor or a clinic today, they're going to ask you where you've traveled. And they will test for infectious diseases like those caused by bacteria, viruses, or other parasites based on the clinical symptoms that the patient is reporting and some of the other signs that the clinician has collected from the blood. ICD is the International Classification of Disease, which is used to classify diseases and monitor morbidity. You may have heard the term ICD codes. These are for the doctors to code whatever they are testing for so that your insurance will pay for it. An infectious disease doesn't necessarily have to be contagious. It's a disease that is caused by an infecting antigen or parasite, such as a bacteria, a virus, a protozoan, a fungi, prions, or viroids. And viroids have only recently been discovered. Prions are implicated in what we call Jacob Creutzfeld's disease, or you may have heard of mad cow disease. Protozoans, if you've heard of any, it's probably the brain-eating amoeba. Some are communicable. That means they spread from person to person. They're contagious. That's the word we use to refer to something that can be transmitted from one person to the next. How contagious a disease is depends on how fast it spreads from person to person. And in the news last few days, last few weeks, there have been talk about a new variant of COVID, and we'll talk about that, which is more contagious. It spreads faster. They're trying to find out why. A non-infectious disease is not caused by an invading pathogen. It cannot be spread from person to person, so it's not contagious. Non-infectious disease are comprised of inherited diseases like sickle cell anemia, or cystic fibrosis, or Huntington's disease, or dwarfism, achondroplasia. Cancer is a non-inherited genetic disease. It's caused by mutations in the actual genes themselves of the cells. Congenital diseases like Down syndrome, which is a chromosomal abnormality. It's also called trisomy 21, where there are 3 chromosomes in the 21st position, are non-inherited diseases, but they are genetic. Physiological disease like a heart attack or malnutrition is also a non-infectious disease. And you can find a list of common infectious diseases at the Center for Disease Control and Prevention, the World Health Organization, and International Classification of Diseases websites. And those are very helpful when you're doing research. Here's a table of some non-infectious diseases. An inherited disease is a genetic disease, as I said, like sickle cell anemia, which is an autosomal recessive disease, which means both parents have to carry one copy of the gene for sickle cell anemia and one copy of the gene for normal blood cells. And in the embryo, the fetus, at fertilization, the 2 genes for sickle cell anemia have to pair up. A congenital disease is a disease that's present at or before birth, and that's like Down syndrome or any other chromosomal abnormality like XO or Turner syndrome or XY. Degenerative diseases are progressive, irreversible, and they result in loss of function, such as Parkinson's disease, ALS, MLS. Nutritional deficiencies are defined as impaired bodily functions due to lack of nutrients, like scurvy, which is a deficiency in vitamin C. Endocrine diseases or disorders involve malfunction of glands that release hormones into the body that regulate body functions. Hypothyroidism does not produce enough thyroid, which is important for metabolism. The converse of that is hyperthyroidism, where you produce too much thyroid hormone. A neoplastic disease is some forms of cancer or abnormal tumor growth that can be both either benign or malignant, and an idiopathic disease is one in which there is no known cause. So we just don't know why these happen. Each disease follows, or infectious disease certainly follows 5 periods of development, shall we say, or progression. There's the incubation period, the prodromal period, the actual period of when you're sick, period of decline when you're feeling better, and then the period of convalescence. So what do each of these mean? Incubation is when you're exposed to a pathogen and infects the body. With COVID, we often don't know that because we're asymptomatic. And that's one of the issues with COVID-19 and its contagion. The prodromal period occurs after the incubation period, and during this phase, the pathogen continues to multiply and the host begins to experience general signs and symptoms of illness, which typically result from the activation of the immune system. You start to feel tired, you may have a scratchy throat, or your nose starts running, you might get a fever, you might get some soreness or swelling or inflammation. These are too general to indicate a particular disease, but at some point, the illness becomes full-fledged, the signs and symptoms become most obvious and severe. You're totally congested from a cold, you have fever and body aches from the flu, etc. Decline is during which the number of pathogen particles actually begin to decrease. The signs and symptoms lessen or begin to decline. But one of the problems during the decline period is patients can become susceptible to developing secondary infections because their immune system has already been weakened by the first infection or the primary infection. Convalescence is when you pretty much feel better. Although, like in COVID with the long haulers, sometimes the illness can cause some permanent damage and the body cannot heal itself. Patients with an infectious disease can be contagious during all 5 periods of the disease. And again, with COVID-19, we've known for a while asymptomatic patients can transmit this virus. There are 3 different types of disease, well, 2 different classifications, and a chronic can be subdivided into 2 classifications. An acute disease is one where you get pathologic changes over a relatively short time. You really begin to feel sick with a cold or the flu. You get a rapid onset of disease conditions. Influenza, the incubation is 1 to 2 days, and you can spread the flu for about 5 days after becoming ill. A chronic disease is something like arthritis, asthma, hepatitis B, something you will have over a very long time period. Sometimes most of them are managed rather than cured. Latent disease occurs when the causal pathogen goes dormant for extended periods of time and the virus does not replicate itself. It sort of hides in the body and cells. And a couple of different examples are herpes. Herpes simplex viruses 1 and 2 can hide and pop out as a cold sore or other forms of herpes. Chickenpox, you may have seen ads for the shingles vaccine. We've all been immunized, you've all been immunized against chickenpox, which is caused by the varicella-zoster virus. But once you've had chickenpox, the virus doesn't leave your body. It hides in cells of the nervous system. And we don't know what causes it to reemerge as shingles, but it can. And so now there's a vaccine against shingles, which if it doesn't actually prevent the shingles, it gives you a very, very, very mild case of it. Finally, mononucleosis, which is caused by the Epstein-Barr virus, can hide in your body and evade the host immune system, but reappear. And that's about it for this lecture.